So here, if we want to get the plasma, we use this type of tube because it's contain anticoagulant uh, materials, for example, heparin or EDTA. And if we want to get serum, we use this type of tube because this didn't contain or they don't not contain anticoagulant materials. In the first picture, they explain when you use needles with the tube with vacuum. We don't want to brush the plunger of the syringe. But here, if we use or if we remove the cap of the tube, we should use a special technique to inject the blood because we should put the blood on the wall of the tube to prevent broken the cell. The purpose of chemistry profile sometimes to the evaluate overall organs function. Sometimes we use to evaluate the health of the patient before a procedure such as surgery, or sometimes we use it to evaluate the optimal function of the organ system. The second thing we use is for diagnosis of disease. Okay, so sometimes there is different option to use for it. The third option, sometimes we use it to evaluate the response to the drug. I mean, for example, I'm scientist looking for the use drug with no side effect for the maybe damaging liver or kidney. So in this situation, I use it also chemistry profile. In this situation, there's renal profile. This constraint just for the evaluate kidney function. For example, including urea and creatine and albumin and etc. Or I use the liver profile to evaluate just for the liver function, including alanine, aminotransferase, and alkaline phosphate, and etc. So I mean this just to evaluate single organs. Or if I want to evaluate general health profile, I use this the previous one liver profile and renal profile, plus to the electrolyte and the proteins. Blood protein, all of them or most of them, they produce in liver. Exception immunoglobulin, I mean antibody, this is produced by plasma cell. About this situation, we talk about it in immunology. After that, we can have some summary about the difference between serum and the plasma protein. The plasma protein contain fibrinogen and factor V and 7. This is important in clotting formation. So the serum is similar. The serum proteins is similar to the plasma protein except fibrinogen and factor V and factor 7. The measurement of protein include total plasma protein, and total serum protein, albumin, globulin, fibrinogen, and albumin to globulin ratio, and other specific protein are used in acute phase protein. There are some physiological factors affecting on the serum or plasma portion. The first one is patient age, and the second one reproduction state. The patient age, as you know, at the birth, the animal based on the amount of the immunoglobulin that get it by mother during the colostrum.